And now I can start my presentation. First of all, I would like to thank you for organizing the community to share our research in this amazing environment. Today, I will share my research about the digital transformation in healthcare services delivery. Next slide, please. Cannot control the slide. Okay. Next one, please. And let me start my presentation with some numbers to understand why we need the digitalization in the healthcare. We learned lots of things during the COVID pandemic. We couldn't take health services for our routine health problems at the beginning of this period, but we took our health service from our home through digital health possibilities. The emergency department visit dropped dramatically during this period for routine health problems, and it expected that by 2014, at least 25% of the health services will move to virtual delivery. The COVID-19 pandemic has globally affected our lives and the economy. Not only did it significantly stress national healthcare systems, but also phased up the importance of virtual care delivery. Because of this, more than 18% of global hospital CEOs stated that investment in digital tools and systems have significantly changed as a result of the pandemic. On the other hand, the people want to monitor their health via digital tools. Therefore, using the telehealth is growing in US and in also all around the world. Next one, please. There is a reality in the world right now. People are living longer than before. Today, the average life expectancy worldwide is at 72 years. It will increase 7 to 7 years. In developed countries, average life expectancy will probably 81, and people in developing countries will live to an average age 71. This trend will increase the total aging population from 727 million in 2020 to 1.5 billion by 2015. People over 65 are expected to make up 16% of the world's population by 2050. This change will cause major challenges for the world's healthcare systems. Next one, please. Due to the growth effects I mentioned in the previous slides, more employees and larger budgets are needed to meet the demand for healthcare. The shortage of the qualified professional is one of the key challenges for the industry. According to Human Resource for Health, the world will be short of 18 million healthcare workers by 2013. There are several reasons for this. The first one is the growing world population and increasing risk of chronic disease. The second one, an aging health workers with staff retiring or leaving for better paid jobs. The third one, too few young people entering the professional and lack of the adequate training. The last one is internal and international migration of the health workers. I believe that the digital healthcare solution helped us to meet this demand and create sustainable healthcare system for the governance. Next, please.
Next one.
This is another important thing for the digital health, the chronic disease. The burden of chronic disease is rapidly increasing worldwide. It has been calculated that in 2001, chronic disease contributed approximately 46% of the global burden of disease. The proportion of the burden of chronic disease was expected to increase to 16% by 2020. Chronic disease also causes more death than all other causes combined. And chronic diseases that are projected to increase from 41 million in 2020 to 52 million by 2013. To reduce the impact of chronic disease, we have to use digital solution properly. Next one, please.
Next one.
We see that on previous slides, we will phase up high demand for the health services because of the population growth, the aging, and the number of healthcare person problem. To solve this problem properly, we can use the digital health possibilities. On that case, what is the digital health? The digital health connects and empowers people and population to manage health and wellnesses, augmented by accessible and supportive provider teams working with the flexible, integrated, and digitally enabled care environments that strategically leverage digital tools, technologies, and services to transform care delivery. Next one, please. And we are using different technologies for now, like mobile health, personalized medicine, telemedicine, telehealth, wearable devices, electronic medical records. And on the other hand, lots of companies trying to develop digital health application and the solution to be part of the next generation of the healthcare systems. And there are ongoing academic work on this area also. Through the Industry 4.0 components like AI, big data, IoT, the healthcare application can monitor our health parameters easily and detect anomalies to prevent health problems. The next one, please. These are two academic works related to digital health applications. The first one is the remote follow-up system for the chronic disease to reduce the cost of disease management and control the hospital capacity. The second one is anomaly detection system for the cardiac problems via wearable smartwatches. Next, please. What kind of technologies are behind the digital health? We are using most Industry 4.0 components in digital health applications also. We need sensors to collect the necessary data and IoT devices to transfer this data to the cloud, which uses stores the data. And to process this collected data, we need AI and big data technologies. To create secure data communication, we have to use blockchain and the cybersecurity technologies. Another important technology for the digital healthcare is the digital twin. I will give more details about it on the upcoming slides. Next, please. I have said that data is the basis of the digitalization in healthcare. It is estimated that 1 trillion sensors are working in the world in 2020. In 2021, each person produced 50 terabytes of data. And every data produced by the people is very important for health, and it is of the great importance in the digital management of the health. Next, please. Because of the data usage of healthcare systems, AI is one of the important technology to develop future of digital health. In the healthcare field, more than 113 AI algorithms have already been approved by the FDA as a healthcare application. This is the very important things for the upcoming algorithms for the healthcare. And we can manage our chronic diseases like diabetes and cancer with support of AI algorithms. Next, please. Another important technologies for the healthcare is the digital twin applications. What is the digital twin? It's a real-time digital profile of the past and current behavior of the physical object or process that helps optimize the business performance. To make clearer definition, it's a virtual copy of physical object. The first definition in the literature were put forward by the Dr. Michel Grace from the Michigan University in 2002. And the conceptual model was presented in 2006. In 2010, it was made available as a digital twin in the NASA technology roadmap. The digital twin applications support most of the industry right now. Next, please. Digital TVIN applications are used in many areas of health. Thanks to the power of the data, we can improving service delivery process and reducing operation costs, improving patient experience and medicine and management of the chronic disease support of the digital TVIN applications. Next, please. I can give one use case about the digital TVIN application in the healthcare. The major private hospitals, which has capacity and the management problems in the field of medical imaging, has provided savings and improvements in many areas by analyzing and rearranging its business process with the digital TVIN technologies. They reached shorter wait times, faster patient turnaround, and increasing equipment utilization and the lower staffing costs. Next, please. This is one of the digital TVIN concept which was developed by the Siemens Healthineers for the people who has cardiac disease risk. The aim of this concept is to collect and monitor all related health and the life data of the people to prevent his cardiac health problem risk. To the true analyze, we have to collect real-time all the related data and the process with this AI-based algorithm to see anomalies. Next, please.
Next one.
That is why we will need the digital health to meet the increasing healthcare demand, the expanded precision medicine, transforming care delivery, improving patient experience, and digitalizing healthcare systems. Let me finish my presentation with one of the video, the related feature of the healthcare. Thanks for listening.
And thank you, Mr. Bayer.
Actually,
and
we have one video to my presentation.
Okay. So we are here. Okay. You can play.
I couldn't control.
It is just PDF form.
Okay.
We cannot play that video. Meanwhile, Professor Bayer, we can send the video to our participation group. Okay.
Thank you. Thank you.
Thank you very much.
Thank you, Mr. Bayer. I believe you are the one important professions at healthcare platforms, and thank you for all important information, and there's very full information for the further times about the digital healthcare. Thank you so much again, and we can continue to our next presenter.